Drug for peptic ulcer disease. Drug for peptic ulcer disease. Peptic ulcer. We are going to classify. So here is the classification based on the mechanism of action. So there is a classification drug in the use of drug which decrease the gastric or inhibit the gastric secretion, inhibit gastric secretion, and another is ulcer protective. Then other class is drug that neutralized gastric secretion, gastric acid, and also known as antacid, and drugs that like anti-H pylori agent, and this is the classification. In this classification, drug that reduce the gastric acid production or inhibit. So that are the proton pump inhibitor. First is a proton pump inhibitors. Then there is a H2 receptor blocker, H2 receptor antagonistic or receptor blocker. Then there is like anti-muscarinic agent, and there is a prostaglandin analog. In that there is a proton pump inhibitor as the omeprazole, esoprazole, pantoprazole, omeprazole, pantoprazole. Then regarding the H2 receptor blockers are the ceemedicone, ranitidine, and then there is a formatidine, roxatidine, then nizatidine. Regarding the anti-muscarinic agents are pyranzapine, and telangiectin. These are regarding the prostaglandin analog. Prostaglandin analog is a misoprostol, and also protective are the drugs sucralfate, colloidal bismuth, subcitrate. Then there is another drug. This is a subcitrate. Regarding drugs that neutralize the gastric acids and acid are classified as the systemic and non-systemic. In the systemic, it's also promote the relief. It's promote pain relief. So in the systemic, there is systemic sodium bicarbonate. Then there is a sodium citrate. Regarding non-systemic, magnesium hydroxide. Then there is a magnesium trisilicate, aluminum hydroxide. Then there is calcium carbonate, These are the systemic. Regarding the anti-inflammatory agent, there is a triple therapy. In the triple therapy, omeprazole, metronidazole. Then there is a clarithromycin, clarithromycin, These are the classification of the peptic ulcer disease drugs.